Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll free at 1-800-522-0071. And you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type that in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Good morning. So let me know, Rachel, are we done with the feedback?
We're good. Yep,
awesome.
All good now. I will let you know if it comes back.
I appreciate that. Thank you. Good morning, everybody, and thank you for joining us for our webinar this morning. Again, just so that for those people who may not have joined us before, the Medicare Assistance Program at the Oklahoma Insurance Department is funded by several federal grants, and what the funding is for is to help people in Oklahoma with any problems they may having related to Medicare, whether that's getting enrolled, what type of coverage they have, if they think they may have been a victim of Medicare fraud, any assistance programs that may be out there. So please don't hesitate to give us a call. Our phone number will be available later on in the program. We would be happy to help you. So today, we're going to focus on marketing guidelines. This relates specifically to Medicare Advantage plans and Part D prescription drug plans, things of that nature. For those people who may not be aware of what a Medicare Advantage plan is, and most of us are now, it's just another way for people to get their Medicare Part A and Part B services provided to them. Rather than being offered directly by Medicare, they're offered through private companies like United Healthcare or Humana or Cigna or something like that. All of these companies do have to be approved by Medicare. Most of these Medicare Advantage plans also include the prescription drug coverage. So an individual who has a Medicare Advantage plan still has Medicare. They're not losing their Medicare. They're just changing the way that they're receiving their services. So rather than their claims going directly to the people at Medicare, the Centers for Medicare and Medicaid Services, their claims are going to that Advantage plan. Medicare, in turn, is paying that Advantage plan to take care of them, to take care of their claims, to make sure that they've got doctors in their network, all of those sorts of things that are typically done by Medicare. So it's just receiving your services in a different manner. Each plan has certain rules that the individual has to follow, and it's based on the type of plan, whether it's an HMO, a PPO, a private fee-for-service plan or whatever, they have different rules. So it's important for people to understand what the rules are related to the type of coverage they've got. For instance, do they have to have a primary care doctor that directs their care? Do they have to have prior authorizations before they receive certain services? Who are the network providers for their particular plan? It may be that they have to use certain specialists if they need care or something like that. Now, people lately have really been giving Medicare Advantage plans a black eye. And in some situations, it has been problematic for people. But at large, Medicare Advantage plans aren't necessarily bad. In some situations, they've been very beneficial to people. They provided them with additional services, such as dental and vision and hearing. They've allowed people to get more coverage at a lower cost. A lot of them have a zero monthly premium. So there are some advantages for some people to having a Medicare Advantage plan. Also, where the person lives can impact how beneficial an Advantage plan might be. If you live in one of the metro areas here in the state, then an Advantage plan might be a good idea for you. But if you live in more of the rural parts of our state, you might want to take a closer look at who the providers are that are available where you live. And let's say that there are certain specialties that you need to access. How far are you going to have to drive to access that care and stay within the network for your Medicare Advantage plan? So some things to consider before you get enrolled in an MA plan. Again, the MA plan itself isn't good or bad. It's just you've got to understand the rules that are required if you're going to be a part of those plans. And something that's very important to help you navigate that process is to make sure that you've got a good agent that's going to help you explore those options. You're always welcome to call us at the Medicare Assistance Program, and that's the kind of counseling that we provide as well. But we have licensed agents across the state that can help you explore what your options are. So there are certain rules that CMS has established that plans and agents are required to follow. CMS has the authority to take enforcement or contract actions when a sponsor fails to comply with the program or contract requirements, or to carry out its contract in a manner that's consistent with the administration of the Medicare Part C and D program requirements. Also, if they're no longer substantially meeting the applicable conditions of the Medicare Part C or D plans. An example of this is if the plan is not able to support the requirements of network providers, if they don't have enough primary care doctors in the network in a given area, if they don't have enough cardiologists or home health agencies, et cetera. Now, what are they capable of doing? What would CMS have the ability to do? Well, they can assess monetary penalties. They also have the ability to impose sanctions. In the past, we've had times when, because the plan wasn't doing what they were supposed to, whether they were violating a marketing regulation or something like that, CMS would suspend their ability to market or possibly even enroll members until they corrected the situation. And including up to, they can terminate a plan if they feel like they need to. On the slide here, you can see the link. If you're interested, you can find out more information about what CMS is able to do when a plan is having issues that need to be addressed for the sake of beneficiaries. Enforcement can be challenging. In the beginning, when Medicare Advantage first started, the agents that sold the products were actually employees of the health plans. They actually had to be employed to sell the product for that particular company. However, now it's completely different. Independent insurance agents are the ones that are selling these products, and they represent multiple plans. They don't just represent, let's say, Humana or United, Cigna, whatever. They now may represent a variety of different plans, and it's their job to assess your situation. Where do you live? What are your needs? Who are the doctors that you see? And help you identify what plan is going to work the best for you. That, by the way, includes prescription drug coverage. Not every Medicare Advantage plan covers every single drug that's out there. So while they're looking at the provider network, they also need to be looking at the prescription drug coverage. The other challenge that was part of the issue was we had call centers. We've all heard about this situation. This is what was involving people like Joe Namath and JJ Walker and stuff like that, where there were these commercials that were encouraging people to call and learn more about these plans that were available out there. And it was sort of a workaround that was giving agents the ability to receive leads about people who might be interested in enrolling in these plans. So these third-party marketing organizations, or TPMOs, would make these outbound calls, or they would receive calls as a result of these ads, and they would gather this information and pass people on to a licensed agent. So that was one of the issues. And the last one is agents can be licensed in a particular state, including Oklahoma, but they may not be located here. Oftentimes, when we're receiving a call where someone's having an issue, we find out that the agent that they were dealing with is actually located in a state far, far away. Someone who probably wasn't doing anything wrong necessarily, but they don't know Oklahoma. They don't know our networks. They don't know who the providers are. They don't know how far it is from Stillwater to Lawton. So that creates problems as well. So what do we do about this problem? Because when we're getting calls about complaints, oftentimes they say, well, the agent told me this, or I heard that. And when we try to investigate it, we get a different story. Now, as of 2023, CMS requires that these phone calls be recorded. All the calls between the third-party marketing organization, a TPMO, and a potential or current beneficiary must be recorded. And included in that definition of a TPMO, that includes agents and brokers. So all of these calls must be recorded, and that includes whether it's lead generation, marketing, sales, enrollment, any calls with those beneficiaries have to be recorded. If you'd like more information about what's included in there, just Google agent broker marketing frequently asked questions, and there's a lot of information there. So any of those calls, whether it's a follow-up call, anything, has to be recorded. And that protects both parties. That's not just protecting the beneficiary. Oftentimes what we find is that a beneficiary didn't understand exactly what the agent was saying. And it protects the agents as well whenever someone's accusing them of fraud. Maybe it wasn't fraud, maybe it was just a simple misunderstanding. Let's talk about marketing do's and don'ts for the health plan. People that are representing those plans, they aren't allowed to ask for information about your bank account or credit card unless it's gotten to the point where you're actually enrolling. If they're just telling you about the plans and sharing with you how they work and stuff like that, they don't need your bank account information. They don't need your credit card number. They don't have to have that information to give you a quote. So don't share that kind of personal information until you've decided you're interested. They also can't just show up at your house. They can't come door to door. So if someone just shows up at your house uninvited to talk to you about something like that, just close the door. They can't call you unless you're already a member of that plan. If you're a member of a United Health plan or a Humana plan, then yes, they can give you a phone call. If you have been to an event to learn more about a Medicare Advantage plan and you give them permission to call you, then yes, they can call you as well. But as far as receiving a cold call from someone asking you about your Medicare coverage, or do you have a health plan, anything like that, they don't have the right to do that, and you should just hang up. More on the don'ts list. They can't require you to speak to a sales agent to get more information about the plan. If you call in response to an ad on the TV, which I'm not a fan of, but if you do that and they say, okay, let us transfer you to a sales agent, you don't have to do that. You know, if they can't explain it to you, then feel free to get off the phone, call us at the Medicare Assistance Program, and we'll be happy to share information with you. They also can't offer you cash or gifts in excess of $15 to join their plan or to attend a sales presentation. Oftentimes in the past, some of the plans would offer a toaster oven or something like that if you just came to their sales presentation. Now that is limited to a $15 limit. They can't serve free meals anymore. They can offer a snack, a nominal, small snack at some of these events, but not a full meal like we used to in the old days. They also can't ask you for payment over the phone or online. They have to send you a bill in the mail. Okay, not a clue as to why this is coming in so slowly, but let's see what's happening here. There we go. They cannot represent what they're selling as a Medicare supplement insurance policy. Uh, I can't tell you how many times we've had individuals that have come to us thinking what they were on was a Medicare supplement policy when in fact they were on a Medicare Advantage plan. So they have to be very, very clear in differentiating between Medicare supplement versus Medicare Advantage. They also are not allowed to sell you a different insurance product like a life insurance policy or a dental policy, something like that, cancer policy, when they're already talking to you about a Medicare health or drug plan, unless you've given them permission to do so. They also can't make an appointment to tell you about a plan unless you've agreed to it. In other words, they can't say, okay, I'm going to come over on Tuesday and I'm going to share with you about this plan we're selling. No, it's got to be more you're driving the car. You're the one that's going to say, they can say, here's what our plan is, here's how the program works. If you would like to learn more about this, I would be happy to talk to you about that. Can we make an appointment? So at that point in time, you can say, yes, I would like to hear more about this, or no, thank you. Also at that point in time, you're going to tell them exactly which products you want to hear about. If you just want to hear about a Medicare Advantage plan and nothing else, that's called setting the scope of the appointment. And you can do that at that point in time. They also are limited on where they can talk to you about their plans. They can't go to a place where you're receiving health care, such as a hospital room, the emergency room, or an exam room. I would hate to think of somebody coming in while I'm wearing a paper gown and talking to me about my insurance coverage. They can't market their plans or enroll you during an educational event. Like a health fair or a conference. All they can do is educate you. They aren't allowed to do marketing at that point. They have to use specific plan names. They can't be vague about, here, let me put you in a plan that's going to cover your health care as well as your drugs. We've recently had some situations where people have really not understood what they were enrolling in. They assumed it was more of a government plan or a government program, possibly even an assistance program, when in fact they were getting enrolled in an Advantage plan. So they are required to talk by name what plans they're speaking about. They have to use plain language. They cannot, it's got to be very, very clear. And if you don't understand, it's your responsibility to say, I don't understand what you're saying. Can you say it again? They also are not allowed, this was another big problem. They've got to be very clear. They're not Medicare. They can't represent themselves as being Medicare. They need to be very, 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 very clear that they are not. Any mail, any signs, anything like that should very clearly say somewhere on there that they are not Medicare or that they are an agent selling insurance products. Now let's talk about working with an agent. Independent agents and brokers selling plans have to be licensed by the state. So anyone that's selling insurance here in Oklahoma has to be licensed to sell here in Oklahoma. Also, each one of the health plans is responsible for telling us, Oklahoma, who the agents are that are appointed to sell their products. So within our system, we know if a certain agent is appointed to sell United Health plans or Cigna Health plans, etc. Also, if you're going to meet with an agent, the agent has to follow all the rules for Medicare plans and some specific rules for meeting with you, such as they can give you plan materials like brochures and pamphlets and things like that. They can tell you about the plan options and how to get more plan information. They're allowed to give you an enrollment form, and they can collect your completed enrollment form. They can also leave business cards for you to give to friends and family if you are in agreement to allow them to do that. Here's what they cannot do. They can't charge you a fee for processing their enrollment into a plan. They're also not supposed to steer you to a particular plan. They're really supposed to be providing you with all the facts so that you can make the best decision for yourself. Now, you as the consumer are more than welcome to ask them clarifying questions, but you need to be aware that they're not supposed to be steering you to a particular plan because maybe their commission is higher on a different company or something like that. They're not allowed to communicate incorrect information about their plan type or use statements like, this plan is the best or the highest ranked or something like that. They also, again, we talked about setting that scope of appointment. They can't tell you about other plan options you haven't agreed to discuss unless you specifically tell them it's okay. They can't pressure you to join a plan by saying things like, you have to join this plan or you won't have coverage next year. Scare tactics was a big problem for some time, where people were saying, oh, you're going to miss out on this opportunity. They're not supposed to be doing that. They also can't, they can hand out business cards. They can give you business cards to give to friends and family if you want to, but they can't ask you to give them names and phone numbers of other people that they want to sell to. They can't require you to sign an enrollment form before you're ready to join. Like, they can't start out by saying, well, let's go ahead and get your signature on this form, and that way if you decide you want to enroll, then I've already got that signature. Nope, don't do that until you're ready to join. A few other key points that we want you to remember. Don't enroll in a plan based solely on their supplemental benefits. A lot of people hear the fact that, wow, this plan has dental coverage or vision or hearing, or I can get a purchase card that will allow me to get over-the-counter drugs for up to $150. That's great, but keep in mind, healthcare is very, very costly. The other things like MRIs and doctor's appointments and surgeries, those are the big ticket items. So you really need to be picking your coverage based on those things. And then it's great if it's got dental and vision and hearing coverage. Don't neglect looking at a plan based on who the network is, who the providers are. What do your friends say about them? Have they had a good experience? Have they had a bad experience? Make sure you're getting the plan that's right for you. If you've got a friend that lives in Missouri who absolutely loves their health plan, that's great. But the plan that they're on in Missouri might not work as well in Oklahoma, or might not have as comprehensive a network here in Oklahoma. So, you want to make sure that you're getting the best purchase for yourself. And a good way to do that is to contact us at the Medicare Assistance Program, because we can help you identify what plans are available, what plans cover all your medications, what networks they use. We're just going to tell you the way that it is. We don't get any kind of monetary gain from a plan or from anybody to steer you a certain way. We just want to give you all the answers that you need to make a decision about the best coverage for you. Now, before we get to questions, I wanted to remind everybody that the Medicare Assistance Program at the Oklahoma Insurance Department offers these free healthcare journals. These are a great way to keep track of your doctor's appointments, your medications, your surgeries, all of that information that you need so that when you go to a new doctor's appointment or you start seeing a new doctor, or you're having a surgery, or there's an emergency and family members are needing your history, this is a great booklet to keep with you to have that information handy. So if you would like one of those, you can contact the Medicare Assistance Program. You can go to our website and request one. There's a place on there that you can do that. So please take advantage of that opportunity. Now, here are the agencies. We do a lot at the Oklahoma Insurance Department, but we have also contracted with a number of area agencies on aging, as well as community action agencies around the state, to provide the same counseling that we offer in the Oklahoma City metro area. So feel free if you would like to speak with one of these other agencies in your area, and you can see the counties that they serve underneath their name in red. Feel free to contact them and they can provide the same counseling that we do. Or you can set an appointment and go in and speak to somebody. So, take advantage of that if you'd like. So now, if anyone does have any questions, we can take that.
Yeah, so it looks like we don't have any questions. If anyone did have something they wanted to ask, feel free to go ahead and type that in the chat, or you can always reach out to us via phone or email if you think of a question after the webinar today.
And while we're waiting there for a minute, I'll share we do have our future Medicare Mondays topics coming up. Open enrollment's coming shortly. So fall open enrollment notices is going to be our topic next month, talking about what are the documents that people will be receiving that explain what coverage they've got and what they're going to be getting. And then in October, we'll be talking more about getting ready for open enrollment. It's always a fun time of year. So now, do we have a question?
I do see someone with a raised hand. If you could go ahead and type your question in the chat. I just went ahead and put a message in there. You can reply directly to that. And if you're unable to get that figured out, like I said, you can send us an email. Ray, what's that email address that they should reach out to?
They can reach out to MAP at oid.ok.gov.
Perfect. All right. Well, I will say that that's probably going to be the best way since we are running out of time. We've only got about 2 minutes left. And Ray, was there anything else we needed to cover?
I was just going to share November. We're going to also talk about preparing for future healthcare needs. And then in December, we'll talk about the Medicare changes for 2025. There are some additional changes that are going to be coming. Probably you'll be hearing about them in the news before then, but we'll have more information about some changes that'll be for 2025 that are going to benefit Medicare beneficiaries.
Perfect. All right. Thank you so much, Ray. And thank you everyone for joining today's Medicare Monday. Bye-bye.